Self-Insured Reporting is a company that streamlines the operations of self-insured employer health plans.
The management of a self-funded health plan requires several different entities. The lead entity is a third-party administrator, or TPA.
Benefit consultants provide advice on population health. And that population health is sometimes through on-site clinics, near-site clinics, and in some cases, direct primary care.
Reinsurance carriers, MGUs, and captives are used to transfer risk. And sometimes reinsurance general agents, GAs, are involved as well.
You have lots of different people doing lots of different things, and Self-Insured Reporting is the platform that brings it all together using common data, and we're able to use that to automate a lot of tasks as well. We start out by consolidating the self-insured claims, the medical claims and pharmacy claims. We scrub the data, we normalize the data. We have over 100 different integrations to receive in claims from different TPAs and pharmacy benefit managers.
It's important that claims data gets loaded fast. One thing about self-insured reporting is that typically gets loaded in less than a week.
We help unlock claims data to show the gaps in care and the quality of providers used. We also risk score members so that you can measure the effectiveness of your benefit strategy over time.
Having claim analytics is great, don't get me wrong, but it's just not enough, because if you only have claim analytics, you can never really answer the most important questions that a client is going to have. They're going to ask, how are we doing versus our budget? How is our reinsurance performing? And if you're only looking at claims information, you can never answer those type of questions. This is why we integrate the reinsurance contract, the plan years and all the fixed costs, plan enrollments, the employee contributions, all of that. And we're the only platform in the marketplace that is doing this type of work. And from here, how you use the platform really just depends upon who you are.
When a benefit broker works with us at Self-Insured Reporting, our first focus is to get them out of the spreadsheets that they are using. And our team works with them to do that. We fully convert them so that they throw those spreadsheets away, even before we receive a claims feed on their groups.
By having the reinsurance contract and all fixed costs combined with the claims and enrollment information, you can really do about any type of reporting you can imagine.
Self-insured reporting is a robust platform. We really like it because it's customizable to our colors and logos.
Budget reports, various reinsurance reporting such as aggregate reporting and large claim 50% of specific deductible reporting, IBNRs, renewal projections using midpoint to midpoint underwriting, it's all there.
All of the reporting that used to be done manually becomes automated. Self-insured reporting saves a significant amount of time and money. And most important, the reporting is accurate.
What we find is that once you take the burden of actually creating the reports off of the employee benefit broker, they have time to take a look at the reports, to look at the analytics and develop strategies to control cost instead of spending all their time trying to create the reports.
Many TPAs in the market are tied to older claim analytic platforms. When so much has changed in the market, they're not able to understand the total cost of healthcare for their clients because their systems don't recognize reinsurance contracts or other fixed costs in your plan.
Having the reinsurance contract fully integrated with the claims gives us lots of capabilities. We have the ability to automate how we're calculating what specific claims even need to be filed, taking that all the way through the filing process and even tracking the reimbursements.
We have integrations that we use to automate the process of quoting reinsurance. All the data needed to quote comes out of our system directly into the quoting platform used by the reinsurance carrier and then back out to our clients electronically. No more PDFs.
When self-insured reporting is in place, it makes things much easier. Everything is at our fingertips as a broker.
As a TPA, it's our job to help clients understand the total cost of healthcare and then help them build strategies to control that cost. Self-insured reporting helps us do that.
The reinsurance marketplace has lots of different players. You have the reinsurance carriers, of course, but you also have captives and MGUs. Sometimes you have reinsurance general agents, GAs. And we end up working with lots of them simply because they all need claims data to do their jobs well.
Over the years, we have developed very robust capabilities around reinsurance for reporting and also to streamline operations.
To start, we calculate all the specific claims and those 50% of the specific deductible level. We then streamline the filing of those claims with the reinsurance carrier, and we can even track which claims have been reimbursed and which have not.
We have lots of reporting around reinsurance, specific and aggregate reporting. The ability to report on contracts with run-in or run-out claims experience, it's very robust.
At Self-Insured Reporting, we have a lot of clients who fall in a category I would call health intervention. They're working to engage all the way down to the member level. And of course, this includes population health companies, wellness companies, but increasingly, this is also direct primary care and even virtual primary care.
Any organization engaging at the member level needs data to do their job right. Otherwise, they're just shooting blind.
By having all of the member claims data and gaps in care at your fingertips, all of the drugs they take and all of their claims, the bottom line is you can deliver better direction and care to members.
I'm not impressed by complexity, never have been. Simplicity is what really impresses me. And the feedback we consistently get on the platform is that it's easy to understand. As someone working with members, you can easily see gaps in care. You can see changes in risk score over time to understand whether or not your efforts are actually working.
As a broker, when you implement population health or direct primary care, it's important to know that that structure is working. And with self-insured reporting, platform allows you to see that those risks are being adjusted each month.
When an employer sees and understands their claim details, they'll often turn to you and say, well, what are we going to do about that? And that's when we get to build strategies to help them solve their problems.
Self-Insured Reporting gives you insights into the data, but none of that matters until you've made the data actionable. Otherwise, you're just admiring the problem.
Most recently, we've added an employee app called Planwell Health. The app uses member-specific medical and pharmacy claims to find areas for improvement for better health care. We're tracking members' gaps in care and the scoring of quality of the providers that they're using. We can even search inside the claims platform and message a member directly, such as those who are due for a mammogram or a hemoglobin A1C for diabetics. Our clinical team can look down to that level and search the analytics and message members directly. Nothing like this has ever been done before. We think it's a game changer.
In this industry, there's a certain amount of service that is expected. And so what we aim to do and what we have achieved and will continue to achieve is providing that level of service.
The client is looking to us to make sure they don't have problems. I got to be able to pick up the phone. I got to be able to get my hands on somebody that knows what they're doing, has time to pay attention to me, is going to get it solved quickly and get it solved right.
You have lots of different complexities occurring when you're managing a self-insured plan. You have a lot of people that are working on this together. You have sometimes very complex reinsurance contracts, and our staff understands all of this, and they're able to create a great experience for our clients.
What you can't put on a spreadsheet is people. And that's why I went with these folks, and it turned out to be everything we hoped for and expected.